leading cardiologists out there that have suggested that statins be put in the water. Maybe if we just put these medications in the water supply and everyone had it from birth, we would eliminate heart disease.
After seeing thousands of people, do you think that it's cholesterol that's causing the problem here?
Don't believe the dogma. The pharmaceutical industry is one of the main funders of medical education.
Do you think there was or has been anything nefarious going on with the systems? The one that comes to my mind is the Sugar Association.
They've now gotten it to the point that if you don't follow these guidelines, you're considered a bad doctor. Your pay is going to be penalized. The narrative, the system says, well, it's not working because people don't do it well enough. They blame the patient, really outright fraudulent.
Today, I'm having on Dr. Ovadia, and Dr. Ovadia is a world-famous heart surgeon who used to be morbidly obese and now is not, and he comes out and talks about all of the truth and the misinformation that's been out there about why we've been told things about what heals heart disease and what the actual reality is. We talk about the incentive programs for heart surgeons. We talk about his opinion on a carnivore versus animal-based versus vegetarian diet. We go into cholesterol. We go into insulin resistance, but ultimately we're revealing the truth. Let's do our part and share this with those that might need to see this and do our part in breaking this system and breaking this matrix and ultimately figuring out the truth. I really loved your book, though. I flew through it in about 3 days. I have literally an entire list of questions here that I want to go through just to ask you, because I know a lot of people that watch my channel have these questions, they experience these questions, but also my mom had heart disease, my entire family had heart disease problems, and it's always just been this thing that, you know, it's just part of the genetics. So I want to get into a lot of these questions, but before I do that, can you give just like a summary, and don't be shy, don't be like bashful, like what do you do and why are you famous and why are you kind of breaking the mold here in terms of heart surgeons kind of challenging the paradigm?
Yeah, sure thing. So, you know, I have now been a heart surgeon for 20 years. During much of that time, I was a very unhealthy heart surgeon. I had reached a point where I was morbidly obese, I was pre-diabetic, and I realized that I was going to end up on my own operating table. And quite frankly, I didn't understand why that was and what I could do to change my course. I had seen so many of my patients, you know, travel down sort of the same path that I was traveling down. I have the family history, I have all the traditional risk factors as it is, but I was trying to follow the advice that I had learned to give my patients, the advice that I was giving my patients at that time, all the standard stuff: eat less, move more, eat a low-fat diet, you know, count your calories, watch your cholesterol levels, and it wasn't working for me and it wasn't working for my patients. And thankfully, I was able to start coming across some different information, start asking some different questions. You know, my journey really started at a medical conference, as it was, a meeting of heart surgeons, and Gary Taubes happened to be the invited guest lecturer. And this was right around the time that Gary had written The Case Against Sugar, and of course prior to that had written Good Calories, Bad Calories, and Why We Get Fat. And, you know, what Gary talked about were concepts that I hadn't really heard about, you know, that the types of food that we eat are more important and have influence over the amount of foods that we eat. And so, you know, I read Gary's books, I eliminated sugar, went low carb, was able to lose, you know, a lot of weight, nearly 100 pounds. For the first time in my life, maintain that weight loss. You know, I had had success losing some weight before, but I'd always gain it back and more. I'm now, you know, 8 years since that time, and I've been able to keep the weight off. And, you know, that really led me to question why I hadn't heard this before, you know, and no, in no ways is this meant to be disparaging towards Gary, but why did I have to hear this from a journalist as opposed to my medical school professors, my colleagues, you know, the societies that I'm a member of? And, you know, why does no one talk about the fact that probably 90% of what I do as a heart surgeon is preventable?
Yeah, I'm fascinated by these systems that we're in because they're, to me, the way I like to talk about it is our realities are really defined by these systems that we live in. They truly are. Not even just like our perception of what health means, but also what causes problems in the body. But then also, all of that translates to how we feel, and that translates directly to our income potential. And then also how we turn out as like a family member or a friend or, anything like a job, whether we decide to build a business. It's all really very connected. And that's really at the core of why I'm so fascinated by this stuff. It's these big systems. And, I direct sales at the company I'm at. It's a very, very large company. So I'm in the world of sales, and thankfully I'm selling a great product. But I know that there's a lot of companies out there that, they're just doing it to generate profit. One of the things I want to ask you selfishly, because I just want to get this out there first, but is, in your opinion, do you think there was or has been anything nefarious going on with the systems? The one that comes to my mind is the Sugar Association. It feels like everywhere I look, everywhere I go, the sugar people are involved in some sort of research that is skewing data. At the time, when they were doing research, I think it was the 50s or 60s, they were looking at, was heart disease potentially caused by either cholesterol or sugar, and both of them were present. And they ended up going to cholesterol, whereas it could have also been sugar, but then we ignored that research. Is that right?
Yeah, so, the decisions that were made weren't purely based in science is probably the nicest way to put it. And yes, you're right. There
Don't be
were
nice.
clearly, fraudulent scientific things that were done. Some of the base studies that led us down the pathway that we went down, we now know were really outright fraudulent. The best example of that being Ansel Keys' 6 countries study, sort of the seminal study that purported to show the relationship between dietary saturated fat and heart disease, on a country basis. And what we know now is that Ansel Keys had data from 22 countries, and he hand-selected the 6 countries that best demonstrated this relationship. But he ignored the countries that showed there was no relationship. Countries like France, that at the time had the highest intake of saturated fat and the lowest incidence of heart disease. So certainly that has gone on. Now, when we fast forward to today, what I see is just that now that the system has been built around this, like you said, the institutions, the systems are just so focused, and they so truly do believe, these things that they say, that they just can't see that there might be another truth and that they might have been wrong in the first place. And I think that's really the problem we find ourselves in today. And it's not that, the individual doctors are trying to do bad by their patients.
Right.
They really, truly do not know any better. As I said, I only heard it because, I heard it from Gary, from outside the system, essentially.
Yeah.
And I was curious enough to look into that. I have had to admit, that I was wrong. I gave bad advice to patients for so many years. And quite frankly, most doctors I don't think are ready to do that. Most doctors are not really ready to examine their foundational beliefs and question that they may not be true. And so it's a systemic issue now, but you're right. It's built upon a lot of fraudulent science, a lot of nefarious things. We know the sugar industry funded the studies that implicated dietary fat over sugar. We know that science was suppressed. We know that studies that were done but never published the results because they didn't support what they were trying to prove. And we find many examples of that as we go through the kind of scientific history of how we got here.
Yeah, if you have those studies, I'm going to drop them down below or I'll find them somehow, but just so that people can see them, or like that research revealing, that there was funding skewing this information. And I think also to your point is just, there's a lot of people that, we all screw up, right? But it really sucks when somebody's life maybe is hinging on your advice and then you realize that your advice was wrong. You don't really want to admit it. But also, I think that's part of medicine. And like a lot of things is like we don't know a lot of things. And so for us to have always assumed that, it is this way because we know it to be, it's like, well, there's so many other things that we still don't understand. So constantly, things are constantly changing all the time. And I think in a way we also have to like kind of let up a little bit on people in the field. They're doing their best to learn, a lot of them, those that are trying, and you kind of have to screw up sometimes here and there. And so I say that, never having been on an operating table really, so maybe I feel differently. I don't know. Ever since I was alive, cholesterol has been the bad guy. High cholesterol is bad. High LDL, HDL, all that kind of stuff. Saturated fat is bad. Correct me if I'm wrong, but I think it's the 50s or the 60s. That was when fat was kind of like banned. I know that in like 1910, that's when Crisco came out, but it wasn't, all these things were happening basically to steer the public away from animal fat, it seems. Throughout time, it seems like cholesterol has been the bad guy, as in the issue causing heart disease and plaque to build up. So in your opinion, after seeing, I don't know, probably thousands of people and experiencing all this, do you think that it's cholesterol that's causing the problem here?
Yeah, so, there are a couple of things we need to look at to try and answer that question. So again, the diet heart hypothesis has been the prevailing hypothesis around heart disease since essentially, the early 1950s when Ancel Keys really first proposed it. And the diet heart hypothesis has two parts to it. Important to understand this. The first part of it is that the fats that we eat influence our blood cholesterol levels. And then the second part of it is that elevated blood cholesterol, in particular LDL cholesterol, is what leads to heart disease. And when we look at both parts of that hypothesis, we see that really neither one has been definitively proven. There's a lot of evidence that the types of fat that we eat in our diet has very little, if any, influence on our dietary cholesterol levels. And our dietary cholesterol levels are influenced by a lot of other things. When you look at patients who present with heart disease, only about half of them have what we consider to be elevated cholesterol levels, and the other half have normal to low cholesterol levels. And when we look at the flip side of that equation, people with high cholesterol levels, again, only a certain percentage of those develop heart disease, and many of them don't. I believe we're looking at the wrong sort of part of the equation. We are looking at the amount of cholesterol in people's bloodstream traditionally, and we should be looking at the quality of the cholesterol in people's bloodstream. And we also need to step back and acknowledge that cholesterol only becomes a problem in the face of damage being done to your blood vessels. So we should be stepping back and saying what's doing the damage to the blood vessels first and foremost, because if your blood vessels are not damaged and you have good quality cholesterol in your bloodstream, even though it might be a high amount, you're not going to develop heart disease in that situation. The final thing we need to acknowledge is the complex role that cholesterol plays in our physiology. People have been led to believe, and quite frankly, most doctors, if you ask them what does cholesterol do in the, in the body, their answer is going to be something along the lines of, well, it causes heart disease or it causes vascular disease. And we really don't acknowledge that it is part of our immune system. It literally makes up the walls of all the cells in our body. So the concept that we just need to eliminate cholesterol from our bodies and our health is going to be, improved really doesn't make sense on an evolutionary, kind of time scale, evolutionary picture. But I admit, again, I didn't think about these things. I was told from the very beginning of my medical education that cholesterol is the primary cause of heart disease, and in order to prevent and manage heart disease, our goal is to lower everyone's cholesterol as much as possible. And I didn't question that until I started questioning it, and that's why I think most people's experiences when they go to their doctors is they just get told you need to lower your cholesterol.
I actually went to the doctor not that long ago just to get some blood work done. And the doctor, which, not hating on this at all, I think everybody should pick their lifestyle for themselves. Doctor was vegan. Everybody probably watching this knows that I'm not a vegan. I don't subscribe to really anything like that, but I eat a lot of meat. And they called me because my cholesterol levels were quite high. And they basically recommended I potentially get on a vegetarian diet. And I was like, this is interesting. Told me that meat was inflammatory and all these other things. I know, it's crazy. And if I didn't research this, I would have 1,000% bought into that. And that's the problem. And it's not that he was trying to do anything wrong or he was trying to help me, right? But totally misinformed. Because to your point, it's like this system, we're all stuck in this framework. And, I wanted to mention something else that you were saying, cholesterol is not bad unless you said our blood vessels are damaged. Isn't it sugar in one of the things that can damage that? Isn't that a large part?
Yeah, so sugar, I believe, is one of the things that primarily drives that. Insulin resistance, I believe, is the thing that we should be focused on most. And sugar is one of the things that influences, vegetable and seed oils are another thing that influence it. Things like smoking obviously influence it. And, we can look at many of these different pillars of our life that ultimately lead to heart disease, things like stress and sleep and, all these other things besides diet and activity. And we can trace them all back to insulin resistance, inflammation, damage to the blood vessels. These are the inciting events that ultimately lead to heart disease. Lowering the cholesterol clearly has been a failure. That's, again, a high-level thing that I point to. Cholesterol lowering medications have been the most commonly class prescribed of medications now for 30 plus years. Cholesterol lowering diets have been the recommended dietary strategy now for 40 plus years. And heart disease remains the number one killer far and away. So that's what I point to again and say something doesn't add up here. And the something that doesn't add up is the original hypothesis, that it was cholesterol in the first place.
Okay. Yeah, so it's kind of going back to insulin resistance, inflammation, a lot of these different things that actually it seems to all go back to that. That's what's causing so many of these problems, right?
It does.
And it's like everything goes back to that. Right?
Yeah, and when you look at the scientific studies, again, that were done on this, it's pretty clear. I mean, I did a review for a talk last year, and every study that has been published that I was able to find, and if someone has a study that, counteracts this, please send it to me. I'm very interested. But every study that, looked at both insulin resistance in some manner and elevated cholesterol, insulin resistance comes out to be a much bigger risk factor, like 5 to 6 times bigger of a risk factor. So it's not that elevated cholesterol isn't a risk factor. It's just that it's not the primary risk factor. Now, again, I believe the reason that we focus so much on cholesterol is because we have an easy fix for that. Take out your prescription pad, write a medication, and you can lower people's cholesterol, which is great, except it doesn't work. Now, unfortunately, again, the narrative, the system says, well, it's not working because people don't do it well enough. And they blame the patient, and they're not adherent enough to their medications, and they didn't start it early enough. And maybe if we just put these medications in the water supply and everyone had it from birth, we would eliminate heart disease. Like, that's literally the thinking. There are leading cardiologists out there that have suggested that statins be put in the water to tackle this problem.
What in the world?
Just insanity as far as I'm concerned. And it's just like, it just drives me crazy that we can't step back and say maybe the underlying theory is wrong. We literally can't keep up with the demands of taking care of heart disease, let alone things like obesity, diabetes. Our medical system is going bankrupt taking care of sick people. And I would rather change the fact that there are so many sick people rather than, all the other things we try and do to maybe make the system more efficient.
Right. Yeah, I mean, I want to get to exactly what that looks like. You talk a lot in your book about metabolic health, and I want to give people this kind of roadmap of how to get there. And I want to talk with you about, your view on all these different modalities of eating. You've talked a lot in there about that as well. But really quick, I wanted to ask you too. To me, it seems odd. Like if something is clearly not working, right? If it's clearly not working, why would anybody have the right to push back on anything that might be new and investigative? I don't get that. And so part of my question on that is, do you have any insight into the incentive program as far as sales is concerned for people, or, obviously generating revenue for this industry? What does that look like? You know what I mean? Like, what is it to have a patient who needs heart surgery? Who gets incentivized? Who gets paid off of that?
Yeah, so, the healthcare system is certainly incentivized upon doing more. The individual doctors aren't really, for the most part, driven by that.
Right.
It's just the way the system works. When there are more sick people in the hospital's making more money. There's more money sort of to go around to everyone. For family doctors, for instance, we now have quality metrics, quality scorecards that doctors are judged on. And oftentimes a percentage of their payment, their reimbursements, are tied to these quality metrics. And one of the quality metrics is the number of your patients with high cholesterol that you've given a prescription to lower their medications, because that's considered the standard of care. And the pharmaceutical industry has been so good at influencing this process that they've now gotten it to the point that if you don't follow these guidelines, you're considered a bad doctor, essentially, and your pay is going to be penalized by that. So again, not the individual doctor, but the system that's saying you need to prescribe these medications. And that I do place on the pharmaceutical industry. But I also acknowledge, the pharmaceuticals industry is there to generate profits for the pharmaceutical industry. Quite frankly, they're not there to keep people healthy. And they'd rather have sick people that they can sell more medications to. It's a subscription plan for them. And so that's where I think the problematic incentives come from. And then we see things like the pharmaceutical industry is one of the main funders of medical education, of the scientific research that gets done. They're one of the main sponsors of the societies that, doctors get their education, their ongoing education from, the meetings we go to, that are supposed to kind of keep us up to date on the science. And everywhere you go, it's sponsored by the pharmaceutical industry, the food industry, and that makes it very conflicted, very problematic to really get a unbiased view of this science and, these concepts.
You have very good political word choice. For me, I'm very I see it as just they're paying. I hear you and I agree with you. It's absolutely not the doctors, in my opinion, that are the problem. I think everybody can see that, right? It's not the individual doctor. It's the information that the individual doctor is given to learn. And if the foundation of the information is paid off by a company who has interests in whatever those benefits are, it will be flawed. And, we saw that with Crisco. This just blows my mind. Like, Crisco was in 1910. I think that was when it was created. At the time, everybody cooked with animal fat. Fat was a very big, we needed fat. This language of low-fat diets didn't exist. And then I think it was in 1948 or 49, the American Heart Association Crisco, the company that founded them, Procter & Gamble, made a donation to the American Heart Association, which was equivalent to what would be today $25 million, to basically recommend Crisco to their patients and put up this ad in the radio to get it out there as this is the best solution. Okay, well, since basically the 50s until now, heart disease has skyrocketed, and that's Crisco is a seed oil essentially. It's vegetable oil. And we know now it's terrible. We know now it's inflammatory. We know all these things, but the foundation of that entire, all of these ads, all of these commercials, everything that everybody took in that they were giving their kids, we genuinely thought that it was good to have that. And then that language that you and I are both, all of us are so programmed of like low fat diets, low fat milk, low fat yogurt, all of that came from that. And so then you have all these sick, unhappy, unhealthy people. And, it's really wild when you tie it all back to these kinds of things where, like you were saying, the funding has a lot to do with this. And I wanted to ask you your opinion about seed oils too, on that topic. So with your work, do you find that seed oils have a lot to do with heart health or, inflammation or, insulin resistance, those things?
Yeah, so, I am very concerned around some of the data we see around this. And again, it's on many different levels. But at a high level, we can, kind of line up the introduction of seed oils into our food supply, and we see the incidence of heart disease and other chronic diseases rise in concert with the amount of seed oils that are consumed. And then we can look at, other populations and trace, when you start introducing these seed oils, their health starts to decline. Now, I admit, that is correlational data. We have very little randomized controlled data around seed oils. It's very hard to do those nutritional studies. But, the couple of studies that we do have, we see some concerning things. So, the Minnesota coronary experiment, which, by the way, was, Ansel Keys was part of the team running that study. And this is probably the best randomized controlled nutritional study ever done because, it couldn't be repeated today. It was a captive population. They literally were doing the study on inmates, residents of mental health facilities. So everything these people ate were controlled. They were all, cooked by the institutions that they were in. And they actually did a very good job of disguising to the people, which group they were in. They were able to basically create, foods that mimicked the usual diet, the high saturated fat diet, and substitute for these polyunsaturated, fats using vegetable and seed oils. And, what they showed in that study was that people's LDL cholesterol levels went down, but the people who were in the experimental group getting the vegetable and seed oils died more than the people that were in the control group. And so what happened to that study? That study results didn't get published at the time that they were completed. It was actually 20 years later until the data was sort of uncovered, literally like in a basement. By that time, Ansel Keys had passed away, but one of his other investigators was still alive, and he was asked, why didn't you publish these results? And his answer was, because we were disappointed by the findings. And, that one study could have literally changed the whole direction, of our history, and it was suppressed. And this is one of those, kind of nefarious things that you point to in history. And then there have been other, studies that have validated that, eating more vegetable and seed oils clearly doesn't benefit our health. And the question then becomes, how much harm is it doing? And, again, we have other data that would point to it doing significant harm. But now we're in a situation where it's hard to even prove that because these things are so ubiquitous that you can't find the control group anymore. You can't find people who aren't eating these things, essentially, to compare them to and say, look how much better their health is or how much worse your health gets when you eat these things. And it's also a time scale problem. These issues don't necessarily show up within a year or 2 years, which is, how long these studies typically run. These are things that take decades to become apparent. But again, the data is very troublesome to me. And I just step back and say, these things aren't essential to life. We went 99.9% of our existence as human beings without eating these vegetable and seed oils. So, why would we think that these are as essential as we're told they are? And the flip side of that being what we were eating for 99.9% of our existence as human beings, why would we think that that would be harmful to us? It just doesn't make any sense.
Okay, yeah, that's a good segue to what I was going to ask anyways, which is, what does work for people to be heart healthy from what you've seen? And I recognize too that this is a growing field, right? Like I think people need to have a little bit more reality behind that, is that everybody's doing their best. We're trying to get there. And so it's going to change in 10 years, maybe not. But for me, I appreciate your approach actually, because you are not dogmatic in the way you approach food. And I think that's really important. I talk about carnivore a lot on my channel. I talk about animal-based a lot on my channel. I think that there's a lot of people that see that and they think, you can literally eat nothing else but meat ever. And if you are a vegetarian or you're vegan or whatever, you're stupid and all these things. And I don't like that. I think that actually all of us who have decided to be conscientious with our food choices actually have a lot in common. We're trying to figure something else out. We're trying to do the right thing. But for me, I also question whether having just meat is right. Maybe some fruit here and there is good. I know glycation is a thing. No one has the answer on that. Raw milk is a thing. Raw dairy is a thing. All these various things that people can eat. So I know you do have a similar approach to, you eat a lot of meat, and that's kind of the foundation. But what have you seen as far as red meat and all these other kinds of meat? Let me just ask you this first and then go into it. Does, in your opinion, red meat cause heart issues and heart disease?
Yeah, so absolutely not would be my answer to that. I do not believe that red meat, again, a food that we have been eating for our entire existence as human beings, is somehow driving this epidemic of heart disease that has only come up in the past 100 years or so, 100 plus years. So that, again, just doesn't make any sense to me. And again, when you look at the science, that is exactly what you see. Ultimately, I think this comes down to eating whole, real food. I try and really make it simple for people. Eat the things that grow in the ground and eat the things that eat the things that grow in the ground. Eat the things that we have been eating for millions of years as humans. Now, once you start doing that, you can then start to get into some nuance. How much carbohydrate? Is fruit okay? Are vegetables okay? And, ultimately I say this depends on your situation. If you are metabolically broken, you are intolerant of carbohydrates. I don't care where they are coming from. I don't care if they're coming from natural fruits, coming from vegetables. You are intolerant of carbohydrates. So after the eat whole real food, you then need to take it another step and say, I need to reduce my carbohydrate intake until I become metabolically healthy. Once you're metabolically healthy and you're active and you have a good amount of muscle mass, if you want to have some carbohydrate, that's probably going to be okay for you. But also realize that you don't need them. They are not essential to life. There is no such thing as an essential carbohydrate. We need protein, we need fat to survive. We do not need carbohydrate to survive. So, you have to consider what's going to work best for you. And then there are other things that come into play. Are you having autoimmune type reactions? And if so, it's highly likely that that's being triggered by something that you're eating. And almost every time it is something in the plant kingdom, it is not something in the animal kingdom. True reactions to animal foods are very rare. The few times that I see them, it's usually related to severe underlying gut problems that didn't come from eating the meat in the first place, but they're there. And, the quality of the animal proteins that you're consuming and maybe the form that you're consuming them in. But the vast majority of the time, when we start looking at things like autoimmune disease and leaky gut, this is being triggered by plants. And again, that doesn't mean that everyone needs to eliminate all plants. That doesn't even mean that you can't do a plant-based diet in a metabolically healthy way. It just means that for the vast majority of people, we should default to what we have defaulted to for our entire existence as human beings, and that's going to be a diet that is founded on animal proteins.
Is that what you eat?
That's what I eat.
Okay.
And yeah, so I eat a mostly carnivorous diet. I've done that now for 4+ years. I, would say I'm in the best shape of my life doing that. I do it because it's simple. I do it because it works well for me. I am hungry less often. I can stay satiated well eating animal proteins. And quite frankly, I have to think less about it. I'm not counting this and, worrying about what's in the food. Does this have some vegetable and seed oils? There's something very powerful about if you just take the steak and you throw it on the grill or throw it in a pan, maybe with a little bit of butter, you really don't have to worry about what might have been snuck into that. As opposed to, other things that you're like, oh, I got to check the ingredient list. Do I know what's in this? There's just lots of complicating factors that come up ultimately.
Well, that's one of the other things too that I think is helpful for me to try to explain this to people too, is like, it's very hard to market or like kind of manipulate a lifestyle that's based in eating mostly meat, because it's meat, right? You can't package it exactly the way you could package crackers, or like a lot of the things that people do with like keto stuff is very, in my opinion, skewed. I'm like, it's kind of getting away from the point. You mentioned something about metabolically broken. So a lot of the people I speak with, actually, not everybody, but there's a whole group of people, a large portion of them actually do have eating disorders. I used to have one. When you are trying to just cold turkey stop eating carbs and you're just going to eat meat and maybe some fruit, maybe that's the type of person that should just kind of eliminate mostly carbs for a while and then slowly bring them back in if they want to, in the forms of like fruit, is kind of what you're getting at, I would think.
Yeah, and the whole thing about eating disorders, again, very problematic, the whole way we've framed that discussion, because many people point to a carnivore diet and say, well, you're restricting all your choices and would call that an eating disorder. And I would, push back and say, no, this is really just returning to our evolutionary history, and this is the way we're supposed to eat. And, we don't acknowledge that processed food and sugar are addictive. And quite frankly, I would say the way that I used to eat was probably an eating disorder. I clearly have underlying sugar addiction problems, and processed food addiction. And, now I would contrast that, against the way that I eat. Eating in a way that keeps you sick, by definition, that should be, what we're looking at as a food disorder, as an eating disorder. And, it's interesting. We now have had some publications recently from some of my colleagues, like Tro Kalasian and Christopher Palmer, looking at, truly looking at the traditionally, I guess you could say, diagnosed eating disorders like anorexia and bulimia, and showing improvement on, carnivore, low carbohydrate diets. Because, I think a lot of that comes from, again, that cycle that you get into when you're addicted to processed food, and then, you get the negative outcomes, the shame associated with that, and you go into these, kind of binge purge cycles. And I'm by no means an expert in eating disorders. I don't want anyone thinking, that I'm here discounting them. I'm just saying it's real interesting that you can look, that we can have people that have these eating disorders, put them on a carnivore diet, and see them get better. When, that would be the exact opposite of what most nutritionists, psychologists, the people that, treat these disorders would recommend.
Totally. I've worked with many, many young girls and boys actually through my channel who have had, I've just kind of talked to them about it just as a person, like, hey, why don't you just give this a shot and just see what it's like? And they'll come back and it's like life changing. And I know it would be because I experienced it myself. I wanted to touch on blood pressure. What does that look like in relationship to heart disease?
Yeah, so we know that blood pressure is one of the significant risk factors for the development of cardiovascular disease. And, the traditional thinking around that was always that, high blood pressure leads to, direct damage to the blood vessels because of the increased pressure. And, there's certainly some validity to that. But what we don't recognize is that high blood pressure is oftentimes one of the early manifestations of metabolic disease, of insulin resistance. And in fact, blood pressure is one of the 5 metrics of metabolic health that we look at. It's a defining feature of the metabolic syndrome is high blood pressure. So the mistake that I think gets made so often by the medical system is someone comes to us with high blood pressure and we say, don't worry about that. We have medications that can control your blood pressure. And patients get put on these medications. And it's another one of these, quality metrics oftentimes that doctors are judged on, like, how well controlled your patient's blood pressure is with medications. And we don't say, why did this patient get high blood pressure in the first place? What should we be addressing in terms of diet and lifestyle to help the patient not need the medications? Because, that is oftentimes one of the first indicators that someone has a metabolic problem. The workup of that, what lab tests to get, what things people should be looking at, I start with the basics. I start with the 5 basic measures of metabolic health. And if people know these numbers and get these numbers where they should be, that's going to be a great start. And understand, yes, it's more complicated and there are other things that you probably should be checking and that, certainly I and many of my colleagues who focus on metabolic health do, but just start with the basics. And so the basics are your waist circumference, your blood pressure, your fasting blood glucose level, your HDL cholesterol level, and your triglycerides. And look at those 5 metrics. If you want to see the parameters, they're in the book, or just go to my website, ifixhearts.com. Right on the front page, you can take the quiz for free, and it will march you through those and tell you if you're metabolically healthy or not. And the statistics are pretty alarming, because when we look at those 5 metrics, 88% of the adults in the United States are not in optimal metabolic health. In other words, they don't have those 5 metrics in line with what they should be.
Okay, and would you recommend for somebody, I know somebody right now very dear to me, who struggles with with blood pressure, I should say. To me, they're pounding protein shakes, which I used to do. We're taught to believe that that's helpful. It's protein, it's high protein, it's low carb, all these things. I feel that that's the inverse of what we want because it's spiking your insulin, which if we keep doing that over time, we get insulin resistance, which is one of the contributing factors to this. Is that correct or is that wrong?
Well, it's going to depend on the protein shake. Yes, protein by itself induces a little bit of an insulin response, but it's usually not going to be problematic in and of itself unless that protein shake has other stuff in it that's spiking your insulin. And yes, spiking your insulin on a repeated basis, chronically elevated insulin is ultimately what leads to insulin resistance. The first principles, like we talked about, eat whole real food. And, protein shakes don't necessarily fall into that. Now, I sometimes have protein shakes. I acknowledge that sometimes, having whole real food, may not be conducive to your lifestyle. And a good substitute may be a nice, clean protein powder in that case. But again, what else is in that shake is going to influence, the effects that may be having on you. I eat, probably close to 95 or more % of animal protein. And, I'm in the best shape of my life. And I've done all the testing and I've, looked at all the things and it only seems to be making me better. And the people that I work with, again, consistently, this is what I see. Don't believe the dogma is kind of what I would tell people. Take charge of your health is ultimately my message to people. If you want to rely on the government, the medical system, your insurance company, the pharmaceutical industry to keep you healthy, you're going to be very disappointed by those results, because that's not what they're there to do. That's not what they're designed to do. And if you do the same things as everyone around you, you're going to get the same results as everyone around you. And as we just said, those results are not very good. 88% of the adults in the United States are not in optimal metabolic health. So if you want to be different than that, you have to do something different than that, and you have to take charge of your life and start making those choices that are going to improve your health.
I love that. It's like, to be different, you got to do different, to break the system, to break the matrix. So right on. Okay, well, I will say in wrapping, where, Dr. Ovadia, can people find you? I'd love to share your socials, your website. I will put a link to your book below, so anybody who's interested in reading that, I read it. I highly, highly recommend. It's not a long read either. I was listening to it at the gym, and it took me 3 days.
Yeah, thank you. So the book, Stay Off My Operating Table, available at all the usual places. iFix Hearts is really where to find me, just about everywhere. So ifixhearts.com is the website. iFix Hearts on Twitter. Over on Instagram, we're Ovadia Heart Health. And then, if you just pop my name into the search engine, you're going to come across me. I love to interact with people. We have so many different ways that we're helping people these days, and that's so rewarding. I have a private telemedicine practice that I work with patients one-on-one to keep you off my operating table. And then we have coaching programs, we have courses, the book, my podcast, all of these channels. Please, come find us, let us know how we can help you, because that's really the mission that we're on, to help as many people as possible to stay off my operating table.
Absolutely. Let's do it. All right. Thank you, Dr. Ovadia. I appreciate you.